My name is Marc Milano, an emergency physician at Bayshore Community Hospital, where I've worked for the last year. However, I've been practicing emergency medicine and attending for 10 years after I trained at Newark Beth Israel back in the early 2000s. I decided to practice emergency medicine largely because it was a job in which I got to interface with the public. I also got to take care of patients and families when they were at their very worst moment, their most desperate time in their lives, and I realized I could have a huge impact on the trajectory of that experience by being an emergency room physician. Specific questions people might ask in terms of practical things is, how long is this visit going to take, or what kind of testing am I going to get, or is this going to hurt? So I try to address all those things at the front end of the visit so they have very realistic expectations and I can allay a lot of their fears at the same time. Well, at Bayshore Community Hospital, the PCC, or the Pediatric Care Center, differs from the regular emergency department in that, number one, it's a sequestered environment. It's its own separate unit within the ED. It's quieter, it's prettier, it's got beautiful murals on the wall and softer colors. It's really geared to be a comforting environment for both patients and their families. The benefit of bringing a child to the Pediatric Care Center is largely that we are staffed by highly trained and skilled individuals both on the nursing and physician side that are well versed in the care of emergent problems that might affect children. Severe infections, trauma, and other things that we really do best. And I think that's the true benefit of bringing a child to the Pediatric Care Center at Bayshore Community Hospital or any of the Meridian Pediatric Care Centers. The types of illnesses or injuries that would warrant a visit to the Pediatric Care Center in the emergency department are various and numerous, actually. The truth is that my advice to parents is always, if there is an instinct that is triggered in you that maybe something is seriously wrong with my child, you should never hesitate to come to the emergency department. And if you think it's super emergent, don't be afraid to call 911. But the things that we talk about and that we see every day are the minor things. We don't see severe injuries or traumas, thank God, or severe infections every day. We see run-of-the-mill things like ankle sprains or lacerations, fevers, minor illnesses, infected things that don't really necessarily constitute a true life-threatening emergency, but do require prompt care. This is why we're there 365 days a year, 24/7, because we want to address the public's healthcare needs at all times. If your child needs a pediatric specialist, we're fortunate to have access to a number of specialties through our relationship with the K. Hovnanian Children's Hospital at the Jersey Shore University Medical Center. This way, while we are managing the acute part of the problem, we can then refer you to a specialist through our network.